What happens when a dad, a mom, a provider, a son, whatever, what happens when these people, when they die or when they can't provide? Like, what happens to our economy? What happens to those family units? What happens to their kids? It is a disaster. And if you can't tell, I'm passionate about it. Hello and welcome to the Sober Strength Show powered by Or Health. I'm your host, Jesse Karajat. Thanks for being here for this solo episode. Look, every once in a while, there could be a topic that I just really want to talk about or I'm passionate about or I just want to educate our audience on, or it could be a current event. And this is one of those episodes. We're going to talk about health insurance today. There is just something that really gets my goat, as some people say, about why health insurance companies make it so hard to get mental health care. They don't treat it like physical health care, and mental health is health. And they make you jump through hoops. They deny you. They don't pay the actual therapists and psychotherapists and psychiatrists what they should. And it forces a lot of really talented, passionate medical providers to go out of network just so that they can get reimbursed. But that puts more costs on the patient themselves. So it's an absolute mess. Drives me crazy. And it has actually been a barrier for myself accessing care. There's been so many times throughout my journey where I just wanted to get in front of a therapist on a weekly basis and just talk and just sort some things out. And I wouldn't, or I couldn't, because either I couldn't afford it, it was too complicated. And I know there are so many other folks out there. As a matter of fact, a little statistic here, Kaiser Permanente did a study in 2024 and found that 27% of U.S. adults who experience some type of mental distress or stress or otherwise do not see a doctor because it's either too expensive or it's too confusing. 1 in 4 people who need mental health care are not getting it for the very reasons I'd stated. So today, what we want to do in this episode is 2 different things. 1, help you understand your rights, help you understand what your insurance should and could be covering. And if you don't have insurance, what rights and care are still accessible for you. But then also, even if you can't get that coverage reimbursed or get anything, you can actually go to alternative resources to get the help that you need. So that's the 2 goals for this show. And I really hope that afterwards, if you don't know, now you know how to get that care. And please share it with somebody if you think it could be helpful. And look, I'll start with this. Culturally, I don't know about you, but I've really felt and seen a shift and an opening up and a softening around mental health, the reality of how many people it impacts, and the need to get people covered and coverage and the care that they need, okay? Like him or not, if you're paying attention to the news, last week, RFK Jr. was confirmed as the U.S. Secretary of Health and Human Services. RFK Jr. himself has been in recovery, sober, if you will, for over 40 years. He claims that he goes to meetings every single day. And when he was an independent running for president, he was very vocal about this very topic we're covering today. The fact that insurance companies won't cover mental health coverage. And he was a big proponent, big advocate for that. My hope is that with people like him in influential positions, people like, there's many in politics right now who are openly outspoken about being sober or just seeking a healthier relationship with substances. People like Tucker Carlson, even Donald J. Trump is sober, doesn't drink alcohol. But there's people on both sides of the aisle. And then there's celebrities like Bradley Cooper. And there's so many people that are out there now where I think today versus maybe 10 years ago, especially 20 years ago, it was much more stigmatized. So there's a lot of people doing good work and good advocacy to get the word out that people need help. Here's actually a clip from RFK Jr. just several weeks ago talking about his own journey with addiction and what he sees as an opportunity to help people break down barriers to get to care. So here's RFK Jr. himself.
In terms of addiction services and substance abuse services, This is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about the barriers to access to care. And we need to improve that. And answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment, but it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
So as you can hear there, the guy's now the U.S. Secretary of Health and Human Services, and he's clearly got a passion for helping people that need it. So look, until that happens though, again, this episode, we're going to focus on how to get the mental health coverage that you deserve. So first, let's talk about something called the Mental Health Parity and Addiction Equity Act, which was passed in 2008. This act was, and again, 2008, so we're talking more than 15 years ago. This act was supposed to do what we all needed it to do, which was make sure insurance companies were treating mental health benefits like they do physical health benefits. In other words, if you go to the doctor, you're complaining is it from knee pain or even something like cancer, automatically you get prescriptions, you get referrals, you get where you need to go, you get the medicine that you need, and insurance companies, for the most part, are not fighting it. But same thing, if you go to a doctor, and if your doctor is smart enough and experienced enough to refer you to a specialist, like a therapist, psychiatrist, psychologist, when you get that claim or when that claim gets sent to insurance, you have to jump through all sorts of hoops, and it's ridiculous just to get the coverage that your very own health insurance, if you have it, is supposed to cover. Now, why is that? So again, the Mental Health Parity and Addiction Equity Act of 2008 was supposed to make insurers start to treat mental health coverage the same, but it didn't. It did not work. Insurance companies found all sorts of ridiculous loopholes. They denied claims. They made mental health reimbursement nearly impossible for millions of people. And just last year, the Biden administration actually tried to fix it. They strengthened the law. They tried to force insurers to follow through on promises. But again, because insurance companies can create so many loopholes and kind of like hide their tracks, nothing really happened. They just delay, deny, and dodge. And real people suffer from this. What actually happens when someone needs healthcare? They're depressed. They're addicted. Maybe they're suicidal. And they're reaching out. They're being vulnerable. They're at a place where they're desperate. They try to go to, let's just say, an inpatient rehab center. They try to get a stay, which can be expensive, covered under the insurance, and they get denied. What happens? Let's find out. Listen to this clip. This is Ryan Matlock. Listen to his story.
This is Christine Doherty.
He wanted to be a firefighter since he was little. Before he graduated high school, he went to community college.
Her son, Ryan Matlock, had already overdosed at least once on fentanyl at 23 years old. Desperate to save himself, Ryan begged his health insurance plan to place him in a residential treatment facility that knew how to handle fentanyl addiction. After a couple of days in the facility, Ryan's insurance denied him further coverage. On Saturday, March 20th, 2021, Ryan's older sister Haley picked him up and drove him home. 3 days later, Ryan died of an overdose. In California that year, fentanyl claimed 5,961 lives. Last year, the toll climbed to 6,850. California requires insurers to cover medically necessary mental health treatment. But to patients, the separation between what that law requires and what health plans provide often feels like a gaping chasm.
So here's a guy who knows he's in trouble, desperately needs help. While in rehab, his insurance company denies his stay. So he can't afford it, doesn't know about any other resources, calls his sister, picks him up. Within a week, he's dead. I'd like to know who denied his claim or his plea. Who? What is that process? Does anyone contact him? Does anyone look into the situation on a deeper level? Or is it just some person reading some sentences, looking at some details, and then looking over at some standard operating procedure without any thought, any humanity, compassion whatsoever, just hits no? And that no goes through, whether that's delivered via email, automation, whatever. That no, that quick no, just wrecks this guy's whole life. Or even worse, is it some automated AI process where here's a human desperately needing help, mental health care to survive, to thrive. And they go through all the work and the effort, they submit it, they wait, they hope, they pray. And then some freaking AI algorithm just says, well, this is his age. This is how many stays he's had. This is what we see the likelihood of this being a repeat user or abuser of the system, whatever the hell goes into that process. But it's just an automated no. And this human being is just out on the street and desperate. It's disgusting. It's disgusting. And there's no accountability. There's no transparency. Most of these people who are getting denied coverage don't have the means to legally fight these decisions, don't have the knowledge to escalate and push back. And it's disgusting. And look, stories like this, Ryan Matlock, how many people across the country could have been helped and could have been saved? And look, economically, like what happens when a dad, a mom, a provider, a son, whatever, what happens when these people, when they die or when they can't provide? Like what happens to our economy? What happens to those family units? What happens to their kids? It is a disaster. And if you can't tell, I'm passionate about it. It sucks. It sucks that this is happening. And one of the things that, again, I wanted to do is to just educate around step by step. What can you do to make sure that you get the coverage that you need or the help that you need? And let's start with this. This is how you fight back. So one, you have to be informed. If you have health insurance, private health insurance, or even if you don't, even if you have something Medicare, Medicaid, dig deep and find out. You can call your insurance provider, you can research online, you can call the government and ask exactly what mental health benefits do you have? Do you have out-of-network benefits? If yes, you can get partial reimbursement even if your therapist in-network, because the first thing that you have to be mindful of is you may know of a therapist or have a preference, but if that therapist is not in-network, and many times today in mental health care, they're not, because economically it's hard for them to be in-network, so they choose to be out-network. That's a whole nother kind of mountain to climb there. But if you have coverage and you don't have a preference of the provider, then you want to seek someone in network to make sure there are no out-of-pocket costs. But you also may have out-of-network coverage, which gives you partial coverage. I know for myself, it really matters to me that I really click with and connect with the therapist that I'm going to sit with. If there's no options in network of someone that I feel comfortable with, I will go out of network. But you have to know what that partial payment looks like, because you also have to balance the financial part of it. All right. So that's step one. Know what your rights and know what your coverage is. Hey, it's Jesse. And if you've been following this show, then you know I've had my fair share of struggles with alcohol over the years. You also know that I built a pretty solid toolkit to help maintain a healthy relationship with alcohol. Things like fitness, mindfulness, accountability groups, and technology. All great, all helpful. But there's one tool I've recently found that blew my mind, and I can't believe it took me so long to discover it. It's called naltrexone, an FDA-approved, science-backed, and affordable medication that helps reduce cravings and control drinking. The first time I took it, I'll never forget, I was skeptical and not completely buying into the idea that a medication can help me with drinking. But just after a few days, I could not believe how effective it was in eliminating all of my cravings for alcohol. It needs to be more better known. And that is where Or Health comes in. And I'm honored to have them as a sponsor of the show. You can have doctor-prescribed naltrexone shipped discreetly and directly to your door. No pharmacies, no doctor's offices, just the help you need. It's online, it's private, and it's judgment-free. And most importantly, it works. As of today, over 35,000 Or members have been treated and 76% of respondents report drinking less in just 2 short weeks. So here's how to get started. Text STRENGTH to 710-710. That's STRENGTH to 710-710. You'll take a quick, discreet survey, and they'll guide you through the entire process of trying naltrexone for the first time. It's easy, straightforward, and honestly, might be the best move you make for yourself today. So if you're ready to take a massive step forward in controlling your alcohol intake, text STRENGTH to 710-710 and let Or Health help you redefine your relationship with alcohol. Another thing that you should know about is something called a super bill. Okay, a super bill, you can ask for one of these from any provider. Now, medical, dental, mental health coverage, whatever it is, you can ask for, request a super bill, which is a detailed, itemized invoice with medical codes. And this is what insurance companies use, they should be using to process your claim. Now, you can ask for that. More on that as to why, but that's really important to have in the event, especially you're going to dialogue directly with an insurance company. So know that you can always ask for a super bill after you receive care. Let's say for some reason you don't get coverage. What you can do with the super bill is most insurance companies allow you to submit a claim online. You can go to a portal, you can upload, you can put in narrative and request reimbursement. So this is even if an actual provider, whether that's a medical practice, a therapist in office, if they're telling you they're not getting any reimbursement or you're not covered, you can take a super bill directly to your medical insurance company and you can request that that claim be processed. In that case, they could be cutting you a check that you would then give a provider, but know that you can do that on your own. And if it's confusing or overwhelming, or maybe you don't have time, there are companies like Reimbursify and Montaya that make it much easier for you to do. And I'll be sure to link to some of those resources in the episode description. So that's step 3, manually taking ownership and submitting the claim yourself to make sure you get the reimbursement. And now the next piece, what happens if it's denied? Appeal. Appeal, appeal, appeal. Most claims that get appealed actually do get some percentage or even all eventually approved. The reason, and this is where it really gets frustrating, insurance companies statistically know that if they deny a claim, you are less likely to follow through. They are relying on you yourself not being persistent, not being informed, and filing an appeal and being persistent. Do not be one of those people. Listen to this quick clip of an expert that actually explains exactly how to appeal a denied claim.
According to the report from the Kaiser Family Foundation, about 18% of in-network claims from people insured through an Affordable Care Act plan were denied in 2020. But that doesn't mean you should immediately pay for the treatment yourself, or worse, go without care. Consumer Report says you have the right to appeal the decision, and that goes for Medicare or private health insurance. Step 1, call your insurance company to make sure there wasn't an error with your claim.
Mistakes can and do happen at multiple points in the claim filing pre-authorization process. They can be relatively easy to fix once you identify them.
If it was not a mistake, ask to speak to the reviewer behind the decision and request an explanation. You'll need this information for your next step, filing a formal appeal specifically stating that you disagree with the decision.
You're going to ask your doctor to write a letter to explain why the procedure is necessary and to include any documentation to help support that, like your medical records and treatment studies and any communication with the insurance company.
Doctors are used to this, so don't be afraid to ask. The next step might be the hardest, waiting. It could take 30 days or longer for an answer, but if you need the denied treatment right away, make sure you request an expedited review.
So if you get a letter that the insurer is still denying the claim, know that both Medicare and private insurance companies are required by law to provide the reason in writing, as well as explain how to appeal the decision with an independent third party.
So as you heard there, if your first appeal fails, try again, and you can even escalate it. Every insurer has a process for escalation, and you can also file a complaint with your very own state's insurance commissioner if you feel that you were unfairly treated or even denied care that you were entitled to. Okay, so again, if you are denied appeal, all right, and have your ducks in a row, have your super bill, have an explanation of your benefits, and be ready to articulate and be persuasive and push for what you deserve. And then lastly, this is an important one. If you've ever heard of a health spending account or an FSA, an FSA is a flexible spending account. These are basically accounts where you can deposit pre-tax dollars to cover therapy, psychiatry, medication, medical care, what have you. And a lot of times you can access these through an employer, but essentially picture it like this, right? So you get paid, you have income, and all of that gets taxed. It gets taxed by the federal government, the state government. But before doing so, if you have an HSA or an FSA, you can take dollars before they're taxed, deposit in those accounts. Then, when you're ready to use them or need to use them, you can pay for your health coverage from those dollars. Why does that matter, right? And personally, by the way, this is something that I take advantage of. So let's just say you're seeing an out-of-pocket therapist, and they tell you, and this is kind of a going rate, they tell you that they charge $120 per hour, right? That's what they're going to charge you. If you just take that out of your normal checking account after you get a deposit from your employer, that money that I'm spending, let's just say it's $120, that money was already taxed. So that's really like me spending $160, right? Depending on your tax bracket, whatever that looks like. So if I take it out of an HSA, that's just $120. That's exactly what the cost is, and it was never taxed. So in other words, you can save, and this is the real takeaway, 25, 30, 35% on your therapy if you take it out of an HSA or FSA instead of having the government tax your money before you pay. I hope that makes sense. I'll link to some educational resources, but that's just one way. If you are going to be paying something out of pocket or any healthcare costs, you can reduce those costs dramatically by having one of those vehicles paying for your healthcare. So again, that's HSA, FSA. That's health savings account and a flexible spending account. Look, for some reason, when it comes to mental health and recovery from alcohol misuse, people don't talk about supplements enough. When I decided to step away from alcohol and rebuild my health, I quickly learned that nutrition and supplementation weren't just optional, they're essential. That's why I choose Momentous supplements. Look, for me, the goal has always been about health span, living better for longer. And when it comes to supplements for high performers, nobody does it like Momentous. Momentous invests heavily in NSF certification, meaning every batch of their products is tested for heavy metals, harmful additives, and label claim accuracy. You got to know what you're putting in your body. And that's why Momentous is trusted by all 32 professional NFL teams and D1 collegiate sports team dietitians across the country. And look, Momentous doesn't offer every supplement under the sun. Other brands can do that just fine. Instead, Momentous nails the basics with bone-crushing consistency to help you build the perfect and intentional routine for you. And when we talk about basics, what are we talking about? What do I take? I take their protein and their creatine. Momentous protein is best in class for muscle repair and growth, while their CreaPure creatine, the purest form of creatine monohydrate, supports both physical strength and cognitive performance. These are foundational supplements that I continue to use to this day in my health journey for physical strength, mental fitness, and emotional resilience. So whether you're taking your first step or your next step in your fitness journey, these supplements are the building blocks of living better longer. Go to livemomentous.com and try it today at 20% off with code STRENGTH. That's livemomentous.com, 20% off with code STRENGTH, and start living on purpose today. So in terms of the step-by-step, one more time, step one, know your stuff, know your rights. If you have insurance, call, understand what benefits you have, do your homework. 2, make sure you're being mindful in network versus out of network. And if you have to go out of network, or really if you have to kind of have a better understanding of the care that you received and your explanation of benefits, ask for a super bill. know that you can go directly to your insurance company and you can submit a claim yourself for reimbursement. If it's denied, you can appeal. And if you don't get the decision, you can escalate up to and including going to your actual state's insurance commissioner. And just as an aside, you can always keep costs down by opting into a health savings account or a flexible spending account. So those are the step-by-steps, and hopefully that was helpful. Now, what happens if you still don't feel like you can get the care that you need or can't afford the care that you need? You still have options. Okay. There's different places you can go. There's free options. There's group options. So I just wanted to list some of those. So something to know about is this. There's something called sliding scale therapy, or just sliding scale. This is the reality that some therapists, and actually many, will adjust their fees based on what you can afford, and you can ask them. It could be on their website, it might not. But if you talk to a therapist, psychiatrist, psychologist, whatever, you can ask them, do you offer sliding scale? Some people say sliding fee. This means you will submit documentation and narrative around your income, and depending on your income, it will place you in a range that'll dictate the actual cost, right? So for other people, they might give their income and they pay full cost because they're kind of on the higher side of income wise. Or you could be someone that doesn't have as much income and they might say, okay, well, we're going to reduce your fees this percentage based on what you make, right? So that's a sliding scale. So know that you can ask for that, and they might not advertise it, but they could have it, and that could unlock the access to care that you need. Another option, if you live near a university or a college, a lot of times there are grad students that are providing quality therapy at lower cost. That's part of their training. That's part of their education. So you could reach out to or go on the website of some of the universities or college and ask, look into their therapy programs or their psychological schools and degrees and just see if you can navigate to get some great grad student care. I mean, look, these aren't going to be people that have the most experience, but it's quite literally better than nothing. And it's definitely something that you could look into. Another option is there are a lot of nonprofit and state programs. So some states, depending on where you live, even have free mental health programs. You might even go to, say, a federally qualified health center. That's FQHC, where they might have a sliding scale for you. They may have reduced costs, reduced fees for services. Again, FQHC, look them up. They're quite common in many different states in America. They are certainly in the state of Colorado, where I am. Another option for you, and this is both affordable and convenient, you could look into digital therapy apps. There are some fantastic apps out there like BetterHelp, Talkspace, and some other ones. I know Sunnyside has a community and they offer different therapists. There's a whole bunch of different ones, but if your particular barrier to care is not cost and it's proximity and convenience, then you should seriously look into online therapy. I mean, and I know there's really nothing like sitting across from another human in a room in a good environment that's, helps you to be vulnerable and open, but digital therapy is better than nothing, and some people actually prefer it. So definitely look into digital therapy. And then there's free peer support groups, right? I mean, we all know, the big ones. You have Alcoholics Anonymous. If substance use is something that is like a comorbidity to mental health issues, but there's online groups, online recovery groups, community meetups locally. There's talk therapy, which typically people use that when you're talking to a licensed credentialed therapist. But sometimes, again, if you can't get in front of someone, it just helps to be around other human beings and just share your experiences, because that can have a therapeutic benefit unto itself. So those are just some options that are available to you. Last thing I'll say is, if you've been kind of bottling up whatever pain you're experiencing, whatever discomfort you're experiencing, whether that's stress, anxiety, insecurity, and not really sharing it, talk to somebody. Just find someone close to you that you feel comfortable just kind of sharing, share your heart, share your thoughts. And if you haven't done that in a while, you'll be surprised. Sometimes it's uncomfortable, but when you walk away, 9 out of 10 times, you're so glad you did it. And that could be the first step towards moving in a healthier direction. So tell somebody, right? You can't do this alone. You shouldn't do this alone. And insurance companies shouldn't leave you hanging alone. So hopefully all of this was helpful. I know lots of knowledge, rapid fire sending your way, but I really just wanted to get this information out there. I mean, look, I work in healthcare. I work for a nonprofit, FQHC. As a matter of fact, we provide behavioral healthcare. I can say firsthand, there are really, really good people in the behavioral health space that just want to help. They want to meet you. They want to, introduce you to different pathways that break down those barriers to care and get you the help that you need. Our government is starting to become more and more invested in this area. They're really trying to kind of equal the playing field because, look, if our country is deteriorating from a mental health standpoint, and statistics show that we really are, the wheels can fall off. Right? Economically, it's disastrous. If people are addicted, if people are suffering from substance abuse and depression, you can't produce, you can't have quality relationships, you can't raise good families, have good communities. So it's so important, which is why I wanted to get the word out. So the system is broken, but I'm deeply, deeply hopeful and optimistic that with the right advocacy, things can change. So know your rights, submit claims, fight, do your homework, appeal if you have to, look for alternative options, find options in your community, open up to people. Just the main thing I would say is don't do nothing, right? Your mental health is just as important as your physical health. Do not let an insurance company or policy decide that you don't deserve the care that you need. So please, if this was helpful, share it with someone. Look down in the episode resources and we'll direct you some places to get more help. And until next time, take care of yourself and I'll see you next week. Live deep. All right, everybody, that's the show, folks. Thank you so much for tuning in to the Sober Strength podcast and spending some time with us today. We've got a favor to ask. If you enjoyed the show, would you please consider subscribing to the show and even leaving a rating and review? That simple act drastically helps us reach more people in our mission to help them live better, longer, healthier lives. You can also follow us if you'd like on Instagram and YouTube for regular tips and motivation around mental health, addiction, and so much more. Know that your support fuels our brand and is greatly appreciated. So until next time, stay strong and live deep.